We'll call the meeting to order. Welcome, everyone. Land acknowledgement.
We respectfully acknowledge that the county of Haliburton is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa nations, collectively known as the Williams Treaty First Nations. We acknowledge the shared presence of Indigenous nations throughout the area and recognize its original inhabitants as stewards of its lands and water since time immemorial.
Thank you. I just have a few opening remarks, and I guess my first would be wow, and that's certainly nice to be here today. But anyway, good morning, everyone, and welcome. It's wonderful to see you here, be able to take part and gather in our new meeting space. As you may have noticed, things look a little bit different than when we used to meet across the road, and I'm extremely pleased with the looks, the aesthetics, everything in the building. Thanks to the vision and dedication and hard work of our county CAO and staff, these new council chambers will now serve as home for our meetings, important gathering place for discussion and decision making and collaboration. With a wide range of accessibility upgrades, this chamber has been designed to be more inviting, inclusive, and welcoming to all. On behalf of County Council, I would sincerely like to thank everyone who helped bring this vision to life, and we're grateful for the time and care and effort that went into creating this space and will benefit the residents, staff, council, and our community partners. We look forward to celebrating this milestone together at the official grand opening in the future. Thank you. Any disclosure of continuing interest? Seeing none. The agenda.
That July 22nd, 2026 Haliburton County Council agenda be approved.
Have someone moved? Councillor Carter, second by Deputy Warden Danielson. All in favor? It's carried. Presentations, delegation, proclamation for International Overdose Awareness Day. Ashley Smoke or Sue? I didn't quite catch what he said. I think she's coming. Okay. Yeah, here she is. Good.
Hello. Apologies for that. Oh dear. Sorry. I have a new computer and I'm very nervous.
You're not alone.
There we go. Okay, so good morning, Warden and members of County Council. Thank you for the opportunity to speak with you today. My name's Ashley Smoke. I'm the coordinator of the Haliburton, Kawartha Lakes, and Northumberland Drug Strategy. Today, I'm respectfully asking Haliburton County to join communities across Canada and around the world by proclaiming August 31st, 2026 as International Overdose Awareness Day. I'm also asking Council to consider supporting the day by holding a flag raising, lighting a county building purple, if possible, and helping share awareness through the county's communication channels using promotion materials or events in the community. You can find those kind of materials at https://overdoseday.com. These are simple but meaningful actions that demonstrate compassion, reduce stigma, and honor those whose lives have been impacted by overdose. Our drug strategy is the Haliburton, Kawartha Lakes, Northumberland Drug Strategy. It's a regional partnership bringing together organizations across sectors to address the 4 pillars of substance use interventions. Our strategy works collaboratively and includes membership from addiction/treatment services, police service agencies, public health, healthcare, harm reduction services, community organizations, and community members, among other areas. We use the 4-pillar approach, which looks at education, prevention, community safety, harm reduction, and treatment in order to address substance-related harms that face our communities. And together we work to reduce substance-related harms and improve the health and well-being of our communities through collaboration, education, and awareness raising. We recognize that no single organization can address this issue alone and that building healthier communities requires compassion, partnership, and a shared commitment to supporting people where they're at. International Overdose Awareness Day is observed every year on August 31st and is the world's largest annual campaign dedicated to ending overdose, remembering those we've lost, and reducing the stigma surrounding substance use and overdose. Beginning in Melbourne, Australia in 2001, the campaign has grown into global movement, bringing together communities to remember, learn, and take action to prevent overdose. This year marks the campaign's 25th anniversary, and their theme is 25 years on and still needed. As the International Overdose Awareness Day campaign explains, for 25 years, International Overdose Awareness Day has brought people together to remember those we've lost and to take action to save lives. The truth is, we shouldn't still need this day, but we do. Those words reflect a difficult reality. Overdose continues to affect families, communities across Canada, including here in Northumberland County, in Haliburton County. But they also remind us that overdose is preventable. We know how to reduce risks and save lives by reducing stigma, increasing awareness, supporting evidence-informed approaches, and treating one another with dignity, compassion, and respect. We can help prevent future deaths. The campaign messaging is also hopeful. While this day is still needed, it doesn't have to be forever. That is the vision behind the day, a future where fewer families experience the loss of a loved one and where every person has the opportunity to survive, access support, and thrive. Why it matters in this community is that overdose is often thought of as an issue affecting larger cities, but we know that's not a reality. Rural communities like Haliburton are affected as well, and they often face additional challenges such as greater distances to services, limited transportation, and fewer local supports. According to the Office of the Chief Coroner, 20 people died from opioid toxicity in Haliburton, Kawartha, Pine Ridge Public Health Region in 2025. So far, in 2026, the number is 31 from January to May. Our region has faced higher rates of drug poisoning hospitalizations than the provincial average. Earlier this year, Lakelands also issued a drug poisoning alert for Haliburton County following an increase in suspected overdoses. Across Ontario, preliminary data indicate more than 2,000 people died from opioid toxicity in 2025. Behind every one of these statistics is a person who mattered, a child, parent, sibling, friend, neighbor, colleague, or loved one. Every loss leaves a lasting impact on families, communities, and the people who continue to carry that grief. International Overdose Awareness Day gives us an opportunity to remember those we've lost, support those who continue to grieve, reduce stigma, and encourage conversations that can save lives. The actions we are requesting today are simple, but they send a powerful message. By proclaiming August 31 as International Overdose Awareness Day, Haliburton County joins communities across Canada and around the world in recognizing that every life has value and that overdose affects us all. We respectfully ask Council to proclaim the day, August 31, 2026, as International Overdose Awareness Day in Haliburton, to raise the flag in remembrance, and to light a county building or landmark purple on August 31st. We also ask, if possible, that you share International Overdose Awareness Day events, messages, and resources through county communication channels. These actions will honor those we've lost, support individuals and families affected by overdose, and demonstrate Haliburton County's commitment to compassion, awareness, and reducing harm. In closing, it a proclamation can't undo the pain of losing a loved one, but it can tell grieving families that they're not alone. It can tell people who are struggling that their lives matter, and it can remind us all that compassion, connection, and community can save lives. This year's theme, 25 years on and still needed, is both a reflection and a call to action. While overdose continues to impact communities, we know that these deaths are not inevitable. By working together, supporting one another, and continuing to build communities rooted in dignity, respect, and evidence-informed action, we can create a future where this day is no longer needed. On behalf of our HKLN drug strategy, I respectfully ask that you proclaim this day. Thank you for your time, your leadership, and your consideration. I would be pleased to answer any questions.
Thanks, Ashley. Any questions? Deputy Warden Anderson.
Thanks so much, Ashley, for your presentation. I just wanted to say that when we move forward making a declaration or proclamation, it seems appropriate to me that we follow through with some action. So I really appreciate the recommendations that you've made on some simple actions that we can take to support this. So thanks very much.
Other questions or comments? Proclamation.
Whereas the Haliburton Kawartha Lakes Northumberland Drug Strategy recognizes August 31st as International Overdose Awareness Day, the world's largest annual campaign to end drug poisonings and to honor without stigma the lives of those impacted by substance abuse and those who have died. And whereas the 2026 theme, 25 Years Still Needed, reflects 25 years of bringing communities together to remember those lost of drug poisoning and to take action to save lives. And whereas the International Overdose Awareness Day highlights the ongoing public health crisis and caused by an unregulated and toxic drug supply and encourages meaningful action and open dialogue around evidence-based strategies to prevent drug poisoning, reduce harm, and support recovery. And whereas the campaign also recognizes the profound grief experienced by family, friends, and communities who continue to be affected by substance-related harms and losses. And whereas communities across Haliburton, Kawartha Lakes, and Northumberland remain committed to reducing stigma, supporting compassionate care, and advancing policies and programs that protect health and saves lives. Therefore, be resolved that I, Warden Dave Burton, on behalf of the Haliburton County Council, do hereby proclaim that August 31st be recognized as International Overdose Awareness Day in support of awareness, remembrance, compassion, and collective action to address the ongoing overdose crisis in Haliburton County.
Thank you. Could have someone move? Councillor Shell, second by Councillor Ryle. All in favor? It's carried. That's carried. The No Wrong Door Collaborative Event Report. Andrew, I don't see Andrew here. Oh, there he is. Okay, I just, yeah. Sue?
Hello, everyone. I'm pleased today to welcome Andrew Hodson, Community Safety and Wellbeing Advisory Committee Chair, as well as Lauren Hunter and Heather Reed of Arising Collective, partners on this project and partners in our community. They'll be discussing today the No Wrong Door collaborative event, which was held in April in Haliburton County and co-hosted by the Community Safety and Wellbeing Advisory Committee, as well as the Haliburton Highlands Human Services and Justice Coordinating Committee. Welcome, everyone. Thank you.
Over to me, Sue. Thank you, Sue. Thanks, everybody. I just wanted to start by giving some context about service delivery in the county. So specifically how things historically have operated, how things have changed, and what the CSWB and other local collaborative tables are doing to try to improve the situation, particularly around community mental health and specifically crisis response. So if we could go to the next slide, please. Is there a slide up? Oh. Maybe if we could start on slide 3, it would be good, please. Yeah, right there. So these are some factors we're outlining here, and this won't be a surprise to the people assembled in this room. We're sort of pushing the ball uphill in many ways in Haliburton County in terms of the formalized services that are present in most larger urban centers. For example, we don't have a Schedule I mental health facility here. So if there's a person in serious crisis in the county, our nearest what's called a Schedule I facility is in Lindsay. So that can be a long, arduous, complicated journey for somebody. And we've got some other factors laid out here, no public transportation, cell service, things of those nature. But it's funny, I would say that our lack of resources paradoxically became our strength over the years. And hear me out on this, because we didn't have so many of those formalized services, we collaborated at a very intensive level to overcome sort of some of these struggles. So, for example, as a crisis worker, your local doctor was accessible to you. And as a local doctor, your crisis worker was accessible, so you could assist your patient in real time with a crisis worker. So These things are honestly inconceivable in larger communities. When you talk to other people, even in CKL, certainly Peterborough, these aren't facets of the practice. So I would say we overcame many of our poverty of resources by pooling them together and working collegially. If we could go to the next slide, please. And so what we're trying to say here is that it didn't matter if you were, I can just move this actually. It didn't matter if you were a housing worker standing on somebody's front porch, if you were a probation officer in your office meeting with a client, if you were a volunteer at a food bank. If you were helping someone in crisis, you had a clear pathway to connect them with the right support. And if you were the person in crisis, which is already, a scary, painful place to be, you didn't have to worry about the complexities of this bureaucratic system floating around, because the person that you were speaking to, no matter who that was, knew where to turn and how to connect you to the services you needed. So out of that, this reality of no wrong door approach began to emerge. We like to tell the story. It's sort of a cute story, but it's somewhat emblematic of how it worked. We had, when I was working at Minden Mental Health, we had a couple of chaps that had tried to hitchhike their way down from Carnarvon on the hottest day of the summer, quite unsuccessfully. These two guys were just covered in sweat, absolutely fatigued, and they'd come to the door and said, "I'm here to meet my probation officer." And we said, "Well, he's another half an hour walk up the road," but we gave them a ride up to their next appointment. It sounds sort of like a cute colloquialism, but I think it sort of embodies how our system worked very, very collegially, where we would put people in touch with the right people. And that approach continued through the mid-2000s. There was funding of a centralized crisis service, the creation of a 4-county crisis line. People might remember that line, 24/7 crisis line. And the development of what we called a crisis protocol. That protocol was born of Haliburton County. It was actually created out of the Human Service and Justice Coordinating Table. We sat around and said, what are we doing? Because we're doing some things really well, but unless we write it down and codify it, what power does it have? So we carved out and put into practice, or into writing, our practice of care, how we got really complex people through a complex system as elegantly as possible. And I would say overall that model for 15 years or more worked remarkably well. Things became more clear, more consistent. And in fact, it was so effective that other communities were reaching out to Haliburton Highlands as a model to emulate. Absolutely true. If we could go to the next slide, please. So I'm using the word crisis. I'm going to continue to use the word crisis. I just think we should maybe stop for a second and define it, because it's a powerful word. We hear crisis. One might be prone to think lights, sirens, police, maybe a suicidal moment, and all that can in fact be true. But we have to remember, crisis is a really subjective experience at the heart of it. So really, it's when an individual's usual coping mechanisms, the things they typically go to when they're feeling overwhelmed, aren't sufficient to get them through a period of stress. That's it. So I think that applies to all. I know it does. It applies to all of us, right? You don't need to have a mental health condition to potentially be in crisis. You need to be somebody who's overwhelmed by your circumstances at the time. So lights and sirens, yes, but also, that neighbor that moved in a couple of years ago and you used to hang out with them, have the odd burger, and now all of a sudden you don't see them very, very much anymore. And when you do, they're sort of withdrawn and quiet. That can be a crisis bubbling under the surface that needs to be addressed in order to address the concern of the individual, but also to be effective as a system, to get upstream of these things. So, your dog running away might be a minor inconvenience to us. To somebody else, that dog running away is the last drop in a bucket, and that person is overwhelmed. And these aren't just feel-good sentiments I'm sharing with you right now. These effective crisis work, it actually gets upstream of police. It gets upstream of emergency rooms. It gets upstream of hospitalizations, which are incredibly arduous for people to go through, frankly. So it gets upstream of all that if we can do effective community mental health and crisis work. And that's just the human cost. I can assure you there's an immense financial cost associated with not getting that piece right. But I'm sure interested people in this room. If we could go to the next slide, please. So challenges, definitely some national trends. Like during the pandemic, these trends played out here. People were burning out. People were leaving their occupations. With that came a lot of, generational knowledge. There was a shift to working at home, which was, absolutely essential during the pandemic, but there's still some work from home being done in this domain, which might not work quite as elegantly in a rural community like Haliburton. The county lost some key people as well, across all the agencies we're going to be talking about. But I'd like to talk about some very local decisions in terms of service delivery that were made locally here. So in 2023, our local crisis provider, which is the Canadian Mental Health Association, is primarily responsible, not only, but primarily responsible for crisis delivery. They disbanded that 4-county crisis program and they rebranded as it's called Integrated Crisis Intervention Services. So practically speaking, that created a number of changes. Number one, it ended that local crisis line that we had in place. And that local crisis line was a line someone could call and get access to a local crisis worker to help them deal with their situation. It could be housing, addictions, relationships, employment, knowing that all those things feed into a larger crisis down the road. So they chose instead to integrate into a national suicide line. Okay, so instead of a local crisis line, they moved to a national suicide line 988. Some of you might be aware of that number. So unlike most providers, they didn't just advertise and promote 988, they restructured their local crisis system around it. Now, a national crisis line, or suicide line rather, is a brilliant thing, but it's not a local crisis line, it's something different. So the phone intake went away from something sort of broad and local. My dog ran away and I live in Wilberforce and I don't know if I can get through this week, to quite specialized with suicide at the center of it, and centralized nationally. So those phone calls were no longer being addressed here. So before that, people that answered the crisis line 24/7 were mental health workers from Haliburton and Kawartha Lakes, and that was no longer the case. And that change also resulted in the end of the ability to people to reach out to a crisis worker directly stationed in Minden, either by person or phone. That wasn't a part of the new crisis program either. If we could just go to the next slide, please. So this is how things used to work in the county for the past sort of 15 years or so. It's sort of a hub, no wrong door. So if you could, where it says no wrong door hub, in the middle there, that's where our community mental health providers worked. So, and that's for children and youth, that's point in time. And for adults, it's primarily the Canadian Mental Health Association. As I said, they ran the 4-county crisis program. And a piece of that, a much smaller piece, is HHS, our hospital organization, has a bit of the role there, but it's primarily CMHA. So, and at the periphery, these are all the helping. So these are food banks, churches, social workers, police officers, anyone in the community, basically, that might be front-facing with somebody in crisis. And this is a bi-directional flow of people. So what I mean by that is if someone walks in and they're standing in a food bank, and it's quite obvious to the food bank volunteer that this person needs a lot more than a box of food. They're teary-eyed, they're shaking, there's something going on. That food bank could steer them into the center, not having to worry about the complexities of what goes on, get them to the community mental health people, the crisis team, and they will sort out, bring in the other peripheral edges, right? So people can flow in basically from any access point at all. And then when they're in the center, those experts can pull in the relevant pieces to help the people in the center. I hope that makes sense to people. What we started to hear, though, from frontline workers, providers, that the system seemed to have essentially collapsed. And not to be dramatic, but that is honestly the word we were hearing. It was a reoccurring theme that the system is no longer working, this elegant, beautiful system. And I mean from skilled experts like policing, EMS, people that had worked in the system, people on the CSWB were saying things like, I have no idea anymore where to refer a client to, or my clients are just getting lost in the system altogether and I can't track them down. And people were also talking about wait lists for service, which was historically unheard of, wait lists. And so it created sort of an incoherent picture. On one hand, we had this immense need for, people are saying we have all these people in crisis and they have to go somewhere. And then there's wait lists, but other people in the system are saying, I used to be run off my feet and I don't have any referrals at all. So it's incoherent. So as CSWB, we're trying to pull this apart and understand some of what was going on. So one of the things we did, we've done a lot. One of the things we did, we brought in the agency primarily responsible for delivering that community mental health at the center here. As I said, that's CMHA, Haliburton, Kawartha, Pine Ridge. In fact, we brought them in twice. We have great representation on CSWB from our Haliburton-based providers, HHS and Point in Time. So they'd been privy to these conversations rolling out and were able to feed in information. But CMHA being based in Peterborough, we, in all fairness, wanted to bring them forward to engage them into the conversation and to hear from them. And we were heartened to hear that actually a great deal of innovation had taken place in the past few years. So we often hear about funding cuts and a reduction in services, but thankfully they'd actually received some increased funding and it tripled their staffing from 1 to 3 in the middle of that hub, crisis workers. And they'd opened a mental health walk-in clinic as a way for people to access care. And they had a mental health bus that was coming up here. Some of you might have heard of some of those things. And obviously these services are just welcome in the landscape of services for sure. But circling back to a lack of referrals, they stated when we asked them that the 3 crisis workers were actually underserved. They were very low on referrals to the point where 2 of the 3 were removed from the county, leaving us back with 1, which seems sort of a disconcerting aspect. And when we were asking about the mobile mental health bus, it sort of sporadically comes up from Peterborough. And when it does, it's not able to go to client homes and it's not able to go to even sort of more rural areas. It's parked at the heart of the villages and ask the clients to come to them. And we were hearing that our clients were having transportation issues getting to the mobile outreach bus. And in terms of the mental health walk-in clinic, I'll just read from the website. It's a fantastic idea, of course, a mental health walk-in clinic, but it's not for people under 16 and it's not for people connected to CMHA. This is verbatim. It's not, they do not prescribe medication. They do not help people manage their medication. They don't help people complete disability applications. They don't provide any sort of psychiatric assessment. And they're not open Mondays, Tuesdays, Wednesdays, or Fridays. They're open 1 day a week. And the last line on their website in bold actually says these clinics are not for individuals who are in crisis. So there's a lot of people that perhaps aren't being met where they're at. And that's not to say that this is the only thing going on in the community. But the pathway to get in the door, there's been a lot of changes. Our local crisis line is gone. There's no longer a direct path to an actual person in the county to refer to. The mobile bus is a great idea, but perhaps isn't entirely meeting the needs of rural people. And as I've said, the walk-in clinic, I would say, has a number of exclusionary criteria. And I'm sure there's plenty of positive changes that came along with this overhaul. There must be. And I have to say, we're very grateful for them taking the time to explain their services because it helped us get a clearer picture of some of the issues from a local level. The main community crisis provider, who was historically right in the center, they're still there, but not in the same way they used to be. And so when the center of any system gets destabilized, as you can imagine, it sort of cascades out into other tentacles. So what we found was that the people on the outside were jumping into the middle to try to accommodate some of those changes. So we have priests sheltering people in emergency situations. We have housing workers dealing with serious mental health issues. We have employment workers dealing with hoarding situations because in good faith, they're trying to stabilize and understand how this new system works. And that's virtually, honestly, what everybody involved told us, that people were saying, I feel like that's me in the middle. And we heard it over and over. So that was sort of a universal sentiment. Can we go to the next slide, please? So given all of this, the working group, which is made up of members of the CSWB and the Human Service and Justice Coordinating Committee, identified that this no wrong door approach, it worked in the past. And maybe we could take pieces of it, not to just be reactionary and go back in time, but are there pieces of it that can be relevant today? I think we go to the next slide because I'm just sort of mindful of time. So the working group decided to bring together service providers together for a facilitated session intended to accomplish these goals. So we hired a Rising Collective, which is a small community group based in Peterborough and Haliburton. And I'll turn things over to Heather to talk about some of the processes and outcomes.
Okay, thank you, Andrew. You can hit the next slide there. Great. And Lauren and I I'll just let her wave at the back here. We're very pleased to be with you this morning, just to give you a summary of the report that was circulated in the sense of the process that we took the group through. So I'll just jump right in. When we had a great day, we had over just 71 people throughout the course of the day at the Minden Community Center. These folks represented roles in agencies from frontline workers to leadership team members. It was a very full day for those of you who were there, you'll remember. We started with a presentation of some background information similar to what Andrew just shared with you. And then we shifted into small group discussions to look at what are the challenges, what are the barriers, and what are some creative remedies to address. So part of the day was just to sort of ground truth some of the contextual things that Andrew's been talking about. And the report that was circulated is a summary of what we heard that day from reporting back, and also we did a mapping activity with the challenges. And I just want to note that those challenges, I mean, that's a big document. And those are the perceptions of the people who were in the room. So some of those challenges can be remedied with some better communication, sharing of information, and some of them are bigger issues to tackle. Also, just to note in the report, we chose to use the word client to represent those receiving service, but also respecting and reflecting that not all agencies use that terminology, but we needed to sort of pick one word. So I'll shift gears just into the summary of the day. Yeah, and one more. Yeah. So we did start with a short opening activity to shed some what's going on that's working, and some of those strong relationships and connections, that sort of spirit of in Haliburton, we just get things done regardless of the resources that we have. People really highlighted the skill of meeting people where they're at, and the important role and contributions that volunteers make in our community. I don't think any of those things will surprise you as council members, because they really weave through many of the things that happen in our community. So shifting to the first activity, which looked at challenges, and this is a pretty high level summary of that, if we want to just shift to the next slide. So looking at, of course, there's lots more detail in the report, but those challenges, also the interagency collaboration, both a benefit and a challenge at all levels. Referral processes, so those things that were being perceived as complicated, restrictive, multiple intake processes, having to tell people stories over and over and over. General knowledge and understanding of what's available, both in the public and between agencies, and then accessibility of services from a whole myriad of angles. So hours of operation, virtual, transportation, all of those issues. So that's kind of theming those challenges out a little bit. We did get into, on the next slide, the creative remedies for those, and they're detailed much more in the report. But we really felt like there were two main themes that came through. One was to look at how do we start creating supportive policy and procedure to move towards a no wrong door approach. So if I can just get that next slide. Yeah, great. And look at central referral processes, shared intake, data sharing, updating that crisis protocol that Andrew talked about, thinking about, is there space for that local hotline to come back? How does system navigation work? So all that policy that really supports frontline workers, and then strengthening the interagency trust and relationships. So addressing the reality that there's a whole bunch of new faces serving community mental health, and how do we as a community inform them about the special things about Haliburton and what it's like to work here, and can we be proactive in doing that? On the next slide, there also were some things, of course, that came up that were a little bit outside the scope of the focus of the day, which was no wrong door. But we didn't want to lose these because they're still important pieces that the CSWB may want to look at. So raising awareness about community mental health in our community, transportation, bureaucracy, and funding, advocating for funding, et cetera. Lastly, in the report, we did suggest some key next steps. And again, these are pretty high level, so there's a little bit more detail in the report. But essentially, it's looking at, okay, so how does this move forward? Who is the local network that needs to be around the table to hold these suggestions, respond to implementing the no wrong door? Taking the report and the information that Andrew's shared and turning that into a roadmap. So what are the conversations that need to happen to get everybody back onto a philosophy that you can't knock on a wrong door during crisis? And then what's that roadmap that really rolls that out in our community? I'm going to leave it there. Andrew's going to give you some summary comments, and then either one of us are happy to answer questions.
Yeah, thanks, Heather. Thanks very much, Heather. So why does this matter to the people assembled in this room? Probably point 4 is the number one reason. Community well-being, looking after each other, obviously. But from a financial perspective and from a systems perspective, every time there's a failure getting upstream of these events, it downloads responsibilities onto emergency services, right? So I think the last thing we want is more mobile mental health teams in people's driveways when there's another option. There's something that's it's there for that particular reason. So there's a financial cost associated with pushing this down the line. Employee burnout is another thing. The people around the periphery in particular, as well as in the center, I should say, everyone involved in the systems I've talked about, the frontline workers and managers, they're absolutely invested and want to do more in this community. I think there's been some system flux, and if we can take care of the system, how it runs, we can avoid employee burnout and those employee turnovers as well. So yeah, the bottom line is we're trying to be proactive rather than reactive, and I think that's how crisis systems work the best. So I think that's the end of the presentation, unless there's any questions for Heather or I. Oh, we've got one more slide there. So just some actions underway. A blue book, some of you guys, if you've been around, guys and girls, and people have been around for long enough, might have heard of the blue book. It's sort of a fabled document that put together all the community resources so that people can help create those pathways and point people in the right direction. The Human Service and Justice Coordinating Committee, who is basically responsible for writing the first crisis protocol, is now tasked with having revision, pouring through. I think it's actually starting tomorrow. They're going through to reanalyze this and to get it underway. What's working, what's not, in a blameless way. Let's just collaborate again. In discussions with HHHS, they've already started re-examining access to their mental health services. They're on our CSB table, and they're very aware that there needs to be some examination and some improvements, and that's underway. Yeah, so I would say that's where I would like to leave it, unless there's any questions for either Heather.
So thanks, Andrew, and Heather, thank you very much. Questions? Deputy Warden Dennison.
Thanks very much for the presentation. This is not a question, but a comment, and I might be sort of getting a little bit ahead of myself. But I had an opportunity to meet with the people who purchased the Frost Center, who will and hope to run a mental health and addiction center. Now, they're not necessarily going to be geared to the grassroots issues that we're looking at, but there did sound to me like there was an opportunity down the road for a partnership with HHHS. They will have a substantial number of professional staff there, and they saw an opportunity to maybe share those staff with HHHS and assist with some of the mental health issues that we're dealing with. So I just thought that it was a really positive approach that might assist, the work that you're doing.
Thank you for sharing that. That would absolutely, any capacity built into the provincial bed system for the recovery portion of the 4 pillars, I think anything we can do, especially locally, to increase that, it's wonderful. Thanks for sharing.
Other questions or comments? Councillor Ryle.
Yeah, I had the opportunity of going to an Alpha conference earlier this year with Lakeland's Public Health. And Dr. Moore, who was one of the main speakers there, he emphasized the fact that healthcare today is no longer a single issue. It's a multiple issue across a gambit of different agencies. And it sounds to me like what we're looking at here is the possibility of starting to look at who can do what the best, and then possibly work with an integration that would give our people, all of the people that we represent, a better lifestyle and better product and better service for what we're capable of producing. Does that sound like something that you are aware of? And is it something that you would accept with Dr. Moore?
I think that's very interesting. I mean, the phrase that went through my mind as you were saying that is, everything flows into our mental health and our mental health flows back into everything. So I think looking at things as comprehensively as possible, it's vital, it's critical. So yeah, I think that's super interesting.
Councillor Dayu.
I add my thanks to the great work on the event and the day and the presentation, and also offer my thanks for how you've underscored in spades what we have known and what the agencies in Haliburton have known for a long time, and that is the only solution that is going to work for Haliburton has to be born in Haliburton. There is no system anywhere else that I have seen in Southern Ontario or Northern Ontario that would easily cut and paste into Haliburton. We're just too different in terms of our population, our geography, our services, all of the points that you've mentioned. And I think you underscored that beautifully, that really something like No Wrong Door, born in Haliburton, is the only way we're going to make a difference here. The cut paste isn't gonna do what we need to get done. So thanks very much for that.
Any other questions or comments? Resolution.
That delegation received from No Wrong Door Collaborative event be received.
If someone move, Councillor Carter, second by Councillor Dayu. All in favor? It's carried. Thank you. Thanks very much. Consent agenda.
That the items listed under the heading consent agenda for July 22nd, 2026 be adopted as presented. And if I might make one technical change, Councillor Dayu was erroneously identified as being at the meeting, but she was not. So we'll make that change as the minutes go forward.
Didn't you any comments on that, Jennifer? Okay. If someone move. Deputy Warden Danielson, second by Councillor Ryle. All in favor? It's carried. To corporate services, finance. Tanya.
Good morning, Warden, members of council. The purpose of the report today is to obtain council's endorsement as part of a funding application requirement to the Federation of Canadian Municipalities Green Municipal Fund Sustainable Municipal Building Program. The program has two phases. Phase one, which is the current, is the grant application for studies, retrofit pathways for municipal building. The funding will provide a grant up to 50% of the eligible costs. As noted in the report, the cost to complete these studies is $87,741.50. The county is requesting 50% from the Green Municipal Fund, and the other 50% is to be funded from the two reserves noted in the report. This phase identifies a pathway to significantly reduce energy consumption and greenhouse gas emissions over a period of time and supports the county's climate action plan and the county's asset management plan by providing the detailed technical and financial information necessary to inform future capital planning decisions. This will position the county phase two, which is the capital retrofit program, and the maximum award for that phase is up to $10 million in funding. So phase one for the feasibility studies is where we are currently seeking endorsement.
Okay. Any questions? Resolution?
That County Council endorses the Corporation of the County of Hastings application to the Federation of Canadian Municipalities Green Municipal Sustainable Municipal Buildings Program for funding to complete the pathway to net zero. Haliburton County Building Decarbonization Feasibility Study. And further, the council authorized staff to submit the funding application and execute all documents required to administer the funding agreement should the application be successful. And further, that the county's financial contribution towards the project as identified in the application be 50% funded through the patrol yard reserve and 50% through the ambulance reserve.
Could I have someone move? Councilor McKechnie, second by Councilor Carter. All in favor? It's carried. Thank you.
Thank you.
Thank you. Planning, Elizabeth and Kim.
Thank you, Warden. The consent process is something that we work primarily with in our department as one of our kind of bread and butter application processes. And over the last little while, we have been working on looking at if we can make the process better. So with that, I will defer to our senior planner, Kim Bishop, as she is the staff member that works in that process the most and is the most familiar with the ins and outs and opportunities for improvement. So with that, I will pass it over.
Thank you very much, Elizabeth. Good morning, County Council. Warden Burton. So the first of two reports that I have for you this morning is a review of an update to the county's consent process, primarily around consultation with the local municipalities. Next slide, please, Travis. Thanks very much. So I'm sure County Council is aware, but for the people watching at home on the TV, a consent is a severance application. Severances are to create a small number of new lots, adjust property boundaries, create easements or rights of way, or register a leasehold that exceeds 21 years. These things require consent under Section 53 of the Planning Act. The County of Haliburton, through its Land Division Committee, administers consent applications together with plans of subdivision and condominium. We process somewhere between 40 to 60 on a yearly basis, depending on the year and the applications. And so these applications are heard monthly by a 5-member Land Division Committee. That committee is made up of an appointee from each local municipality and the County of Haliburton. These approvals are subject to recommended conditions of consent approval, so things you need to do to get to the finish line to finalize your consent or severance. These are recommended to the committee by the Land Division Committee planner, that's me, typically in consultation with local planners and a resolution from the local council. So according to the county's official plan, most application types we receive require written comments from the local municipality. The plan requires anything that changes the property boundaries of a parcel, include a pre-consultation with the local municipality as evidenced by written comments. These comments are typically called pre-consultation. That's when you see them on your local council agendas. They're the pre-consultation comments. And to get these comments, processes vary a little bit across the 4 municipalities, but typically it requires a completed county consent application fee. The current fee for new lots is $650, a sketch, and in some municipalities, a municipal pre-consultation form. Next slide, please. So when we talk about pre-consultation, it's a very common practice in land use planning in Ontario, and it is addressed in the Planning Act. So this is typically considered to be a meeting or a discussion between staff and an applicant on their application. There's a lot of benefits to pre-consulting on a planning application. For applicants, it gives the opportunity to ask questions and receive feedbacks on your proposal before it's sort of sitting in front of an approval authority. Staff can also provide information like potential recommended conditions of approval that they could foresee, or the studies that or reports that local, county, or provincial policy or regulations would require as part of a complete application. The big benefit on the municipal end of things is that pre-consultation is designed to improve the quality of the first submission of an application we receive. So the goal here is that when you submit your complete application to the approval authority, so for a consent, that would be the Land Division Committee, having pre-consulted, you know what is needed for that complete application, and staff have let you know what generally the requirements or the kind of guidelines are going to be for what a good application would look like. We provide written comments typically following a pre-consultation because this provides clarity to applicants, especially applicants who are not professional planners and for whom the planning process is confusing. Next slide, please. It's important to note that pre-consultation, as it's sort of envisioned provincially, is not an endorsement of an application, whether from staff or a council or approval authority. Pre-consultation is really meant to be a conversation to improve the quality of an application. And with Bill 185, which I believe was 2022, there's been so many updates to the Planning Act, I can't quite keep track. Municipalities can no longer mandate applicants to submit pre-consultation requests by bylaw. We can encourage it, and we very much do encourage it. But the provisions of the Planning Act that allowed municipalities to pass a bylaw requiring folks to pre-consult on Planning Act applications has been nixed. Next slide, please. This is a very complicated, convoluted looking process map. What we wanted to do when we were talking about the consent process is we wanted to see what it looked like from very beginning to the very end. A copy of this is attached to the council report, so you don't have to try and squint at this screen. But the general flow of this process right now is that you are required to submit a pre-consultation request, as I outlined before, to the local municipality. You fill out that county consent application, you pay a fee. The local staff review that against local policy typically, and then they provide a recommendation report to their local council for endorsement. That endorsement that comes from council by way of council resolution is considered the written comments that the county receives. This process has some issues. There's many ways to initiate comments. So you can contact the local municipality, you can contact the county. They'll refer you back and forth from one to the other. You know, if you start with the county, I have to inevitably send you to the local municipality. If you start with the local municipality, they're typically going to send them to me to have a sort of preliminary conversation before I send them back for pre-consultation comments. Where applicants start with the municipality, county doesn't always get looped in early. That's really improved in the last, I want to say, year, because we've been working interpersonally with the staff to make that happen. That's not necessarily something that's happening as mandated by the process. Most of the local municipalities require a fully executed consent application that has sometimes been commissioned by a commissioner of oaths, a sketch and fee for those comments. If the pre-consultation comments lead to changes in the application, which often a pre-consultation could do if you're sort of doing it the way we're talking about, you would then have to refill out those applications, revise your sketches, and have them recommissioned to submit to the county afterwards. Because of this process, applicants are often pre-consulting with county and local staff before they submit their pre-consultation request to the local municipality. So in effect, we're pre-conning on a pre-con, which is frankly dizzying. So next slide, please. So the pre-consultation process currently involves 2 applications, 2 staff level reviews, 2 planning reports, a local council endorsement, and then consideration by the Land Division Committee for a single Planning Act application. We don't require this for any other type of application, maybe outside of a subdivision or a condo, which is typically a much larger, more impactful application. County and local staff hear constantly that this is slow, this is frustrating, this is confusing, this is expensive from applicants. Often when people come to the counter with their pre-consultation comments at the county, they hand them to me and I say, great, now I can receive your application. And they say, but I thought that was my application. It also creates a real duplication in effort between local and county staff. We've got 2 sets of staff reports going, 2 sets of sort of presentations to council or committee. And because pre-con is sort of go to the local township, what we're often seeing is local staff are being required to carry the load of education and correspondence with applicants. One other note, we're hoping that it'll also be sort of resolved in our sort of comprehensive update to the county official plan, is right now the county and local plans are not necessarily totally aligned. So the Planning Act requires that local plans conform, which is a fairly strict standard, to the upper tier plan. is some language across many of the local plans that does not strictly conform to the county plan. So sometimes we're getting comments from the local municipality that have been endorsed by council that I, as a county planner, have a difficult time making a recommendation to the Land Division Committee because it doesn't sort of conform with the official plan of the County of Haliburton. And the other thing that I think is very important is that pre-consultation doesn't require a complete application. So say you need an environmental impact study because there's a large wetland on your property, say you are within 300 meters of a lake trout lake at capacity and you need, an environmental study of some sort. That's not required to be submitted with the pre-consultation request. And so endorsement from council at this time is going to be on the basis of incomplete information. So staff and council are trying to make a recommendation when they don't necessarily have all of the information to make a good recommendation or make a good endorsement. Next slide, please. What we're proposing is a minor change, rejig to this process. We call it the one window approach. So this was first kind of identified in the 2021 service delivery review that was completed by Strategy Corp. I believe it was recommendation number 3, was that the consent process be streamlined to improve this issue. So you didn't kind of have this back and forth because it was something that through the community consultation back in 2020 and 2021 was identified by the development sector as something that was particularly frustrating with service delivery in planning in Haliburton County. So we have been working internally to improve this process. The local planners typically send everybody to me first. We have a conversation and then I send them on for their pre-consultation comments. But we'd really like to ratify that approach and streamline it so people aren't feeling like they're being bounced back and forth. So the way this works is applicants will submit their request to the county, where we will screen those proposals against provincial, county, and local policies. We will then circulate that proposal to the local municipality, and the local planner can comment on any additional complete application requirements, potential municipal conditions of approval, things like rezonings, minor variances, things like that, and provide feedback on the conformity of the proposal with local policy and bylaws. We then provide a single set of consolidated pre-consultation comments that have been reviewed by both local and county staff. Applicants can take those comments and then get working on their application. Next slide, please. And when we receive a complete application at the county, it would be circulated to the local municipality for endorsement at that time. So there's a couple of options for endorsement at this point. So council can endorse the applications the way they've been doing them now. They're just doing it later in the process. Once the complete application has been received, any studies or supporting materials have been provided, county staff will provide a brief to council with the circulation, and council can consider it and provide an endorsement or not. Alternatively, councils do have the opportunity to fully or partially delegate some of that endorsement to staff if they see fit. The great thing about this is that it's a bit of a choose your own adventure for the local municipality. Depending on how involved council wants to be at the endorsement stage, they can endorse everything, they can endorse nothing. It's entirely up to them. Where municipal councils have chosen to fully or partially delegate that endorsement to staff, county staff are recommending that we would provide a quarterly update of Land Division Committee activity to the local municipality. It can just go on your consent agenda, and that way councils are being kind of kept up to date with what's coming through the Land Division Committee, what their staff have provided an endorsement to. And if there are any concerns or questions about those, they can certainly pull them from consent, and a county staff member can attend the meeting and answer any questions. Next slide, please. This is the proposed process map. Still a lot of steps, but not quite as busy. You will note that the orange, which is the local municipality, is there's a lot less of those squares here. And the blue, which is the county, they're taking on a lot more of the work. And that's the important thing here. The county has carriage of these files through the Land Division Committee. We should be responsible for the education and correspondence with the applicants. Local staff here are just reviewing and providing commentary on policy and bylaws. The big benefit is that we're getting a single set of comments that helps guide a complete application. There's no need to complete a preliminary application to submit for review. We're really going to want some basic information and a decent sketch, and that's going to give us the information we need to do a pre-con review. We have 90 days at the county to make a decision on consents. This is similar to a minor variance or a zoning bylaw amendment. So we have lots of time to receive an application, circulate it to the local municipality, get it on the agenda, get comments, and get it to the Land Division Committee. And sort of something that just kind of came up while we were working on this process is in Minden Hills, they've completed their development approvals review process. One of the recommendations of that development approvals review process was sort of mapping the consent process, determining what was a township job, what was a county job, and then sort of moving from there. And it is my understanding from speaking to the manager of planning at Minden Hills, their council has chosen to delegate the commenting and the endorsement of these applications to their staff at this time. We'll still bring this report to them if council chooses to endorse today, because they may like to receive our quarterly update. Next slide, please. And this is just our sort of kind of review of the comparison of the two. So the big thing here is we're really reducing the amount of sort of touch points that the applicants are having to make. That's a big sort of customer service thing. They start with a county planner will provide those comments. Internally, local and county staff will sort out all of the details between themselves. Council is still being provided an opportunity to provide feedback or endorsement if they so choose. So they're not losing that ability, we're just moving it. And it is our hope that by moving to this model, we can reduce or remove the high cost for a pre-consultation fee. So right now, local staff are spending a lot of time and energy corresponding with applicants, writing a fulsome planning report, presenting it to council, following up. We're hoping that because their role will become more of that of sort of like an internal peer reviewer almost, county staff will be carrying most of that kind of weight, which we have the capacity to do. We would be in a position to lower the cost or remove the cost for those comments. And finally, this is more consistent with the Planning Act. The Planning Act doesn't really allow us to mandate pre-consultation, so we want to make it as easy and painless as possible if we can. Next slide, please. So I've gone through some of the benefits already. I won't reiterate that. But the big thing is we think the benefit here is that it's reducing red tape. The direction from the province over the last four years has been to reduce red tape, reduce the number of submissions, simplify requirements. That's what we're hoping to do here. It also allows local staff to focus on applications that they have carriage of that also have strict Planning Act timelines. So it allows more capacity for those staff to do that work. Next slide. As we mentioned previously, there is an opportunity for some delegation should council choose to do so. So the Land Division Committee receives a bunch of different types of applications. Some of them are highly technical, like cancellations or validations. Some of them are kind of innocuous, like lot additions or easements. In my experience, as a county and local planner, and as somebody who has worked as a consultant in the county, councils are typically most interested, in my experience, in new lot creation. Delegation of some of the other approvals, particularly cancellations and validation of title, which are highly technical, would really speed up the process. And as we've mentioned, we can certainly provide any and all reporting to local councils that they might feel they need from the Land Division Committee. Next slide, please. So I've done a lot of talking. Should council endorse this change, we would be delegating to the local councils to ask for sort of their endorsement of this approach as well. Implementation, if we get it, would be over Q3 of 2026. And in that time, we would be updating our local and county planning pages to direct people sort of in the right direction, create a standard form commenting letter, sort of kind of a plug and play that local and county staff can use to provide comments, and then have another meeting with the local area planners to talk about sort of who we're directing these comments, to, and to sort of talk about sort of service standard timelines for those kinds of things. In our preliminary discussion with the area planners a couple of months ago, there was a lot of enthusiasm for this approach. And so we typically meet quarterly with the county planners, so we would bring this up with them at our next meeting. And we would provide an update to county council at the start of the new term. So we'd be looking at first quarter of 2027. Thank you. I'm happy to answer any questions.
Questions? Deputy Warden Danielson.
Thanks very much, Kim. And I will say, I really appreciate the opportunity as the chair of the land division to, have a little bit of conversation about this in advance. I mean, everybody here has heard me talk about streamlining. I really like the opportunity to reduce, the fact that people need to make 2 applications, that there's additional costs, there's extended time periods involved in our existing process. However, I remain concerned that there are some circumstances where, for instance, a ward councillor may have more knowledge about a particular application than the planner might have. And I'm very concerned about complete removal of opportunities for local councils to comment. Now, where that would fit into the process, I'm not quite sure. But I'd be very concerned to see local councils cut out completely from the process, or the ability to be able to make a comment at some time before formal approval is made for the application.
Certainly, and
And my apologies if I missed some of what you said, because
no, that's
a bit of a hearing issue here.
That's okay. So through the warden to the deputy warden, we are providing an opportunity here for local councils to choose the level of involvement that they want to have. So if local councils wish to be circulated and provide an endorsement on every single land division file that comes in, there's no issue or concern with that. What we're really proposing is that we're not doing that before people submit an application to the county. We're really just looking to do it once they've submitted an application to the county, and which is really the time that any sort of decision-making or endorsement should happen, because pre-consultation is truly designed to allow staff to just have conversations with applicants about sort of conformity or consistency with policies and bylaws. So certainly some municipal councils may choose to delegate that. That is their prerogative. We're not pushing one way or the other. We're just sort of providing some options. So certainly if your council wanted to receive a consent proposal before it goes to the land division committee for every single one, cancellations, validations, anything that goes, we have no issues accommodating that. And if there are questions about that application, because I would submit a sort of a small, like an abbreviated version of the planning report with it. If there were questions about that, once council had an opportunity to sort of review the agenda, certainly myself or Liz can attend that council meeting to answer sort of further questions or provide any feedback or receive any feedback from the local council. I hope that addresses the concern.
Other questions? Councillor Carter.
Thanks for the presentation. I know that you've said that you've, consulted the local planners and you're working together and so on. And I know that there's still a number of steps to go through before this is finalized, but do you feel that you have consensus amongst all the local planners and county planners on this? Is this something that everybody wants?
Yes. So through the warden, pardon me, to Councillor Carter. So all of the local planners that we've spoken with, were enthusiastic about this. I did have an opportunity. It wasn't at the area planners meeting, pardon me. English is tough today. We didn't have an opportunity at that meeting to discuss it with Mr. O'Callaghan, who's the former planner at Algonquin Highlands. I, however, had a conversation with him prior to that meeting, sort of just talking through that process. And Sean was a big fan of sort of streamlining where we could as well. So there were no particular issues there as well. I will also just note, and I won't go on, but following the service delivery review, the planning working group in 2022, led by the Algonquin Highlands CAO Angie Bird, we were talking about this process. It didn't get implemented, but there was consensus at that time of that kind of group of people at the table as well, that it would be a good idea to go with this approach. So yeah, we made sure we talked to the people that would probably be the most affected before we brought a report to council, for sure.
Other questions? Councillor Casey, go ahead.
Yeah, thanks for that, Kim. Again, I'm new to the atmosphere here on that note, but I have to echo Councillor Danielson's comments there. My own opinion is that we keep the initial submissions local, so we're getting more of a local, more, I'm going to say, refined feel at each individual municipality. I feel that your one window comment should be kept at the local municipalities, and the county then is more a review instead of a double application on that note to streamline it. Again, just my own opinion, it feels better in my own mind. Of course, we all got to go back to our planners and counselors and have a chat about all this before it gets implemented. But it's a comment I have to make, and it's not being condescending to anybody, but I do feel that it's one or two steps removed from maybe what the local municipality wants, or what the counselors may pick up from the people in their ward. But anyways, thanks.
Elizabeth?
Through you, Warden. Appreciate your comments, Councillor Casey. I think one of the biggest items to note about the consent process is that the carriage and the approval authority does rest with the county, or the delegated committee of council here at the county, being the Land Division Committee. Having carriage through the local municipality puts a lot of work on municipal staff when they're not the approval authority at the municipality. The proposed process still maintains that direct input from the local councils. It just moves that from the start, where incomplete information might be presented to the local council. We have had instances where those technical reports, as Kim mentioned, haven't been ready at the pre-consultation council endorsement time. So council endorsements are predicated on potential satisfactory technical studies, for instance. And there's nothing that requires applicants to have that information available at that time when those decisions are being made. And sometimes it can put councils in an awkward position where they're theoretically recommending approval on something that might actually have problems down the line when those technical studies are available. So I guess to wrap it up, it is a lot of staff time for the local municipal staff at this point when they aren't the ones seeing the application through to a decision. We're trying to just make it a little bit more equitable by bringing the onus of that up to the county as the approval authority.
Councillor Rao.
Yeah, first off, thank you for the presentation. I don't have a problem in principle with what you're talking about. I'm sure they're going to tweak it slightly between now and when the actual product comes out. My question is more related for the public itself. We're talking about this stuff, and a lot of times the frustration comes from the actual people who try to use this program not knowing where to start. There's no Coles Notes that gives them some kind of a clue as to how to get their program together. So their consultation in the beginning is to just find out where square one is. And what I'm kind of hoping is that if we're going to make the consultation much more focused on the process rather than getting the process started, are we going to be able to know whether it's at all four lower levels and at the top or not? Is there going to be some kind of an information position on any or all of the websites where someone could actually go and say, oh, I need this service. I'm not sure how to get it going. And, I have to apply through the county. Okay, and now how do I make that start? Are we going to be able to do that for them? Because that's where I get a lot of frustration back. Nobody knows how to get the thing started.
So through the warden to Councillor Ryle, one of the biggest frustrations is sort of who's on first with these scenarios, and who do I start with? Where does the information live? And the fact that sort of where it starts and how it starts varies across 4 local municipalities for an application type that is ultimately sort of a county-wide application. It's a little different than like a zoning bylaw amendment or a minor variance where typically those types of approvals are sort of hyper-local. So what the goal would be, and it's something I think we've started to improve kind of in the last 8 months to a year, which is right now, the planners are sending kind of everybody to have a conversation with the county first But what we'd like to do is really get direction from this council and the 4 local councils that the county is the one who has those conversations with people about sort of how they start, where they submit, what is a severance? How, how much frontage do I need on a road? Those very sort of standard questions that for people that don't work in the development sector can be confusing and almost seem nonsensical. So the goal, I think, in this is one, having it come in. So we're talking today about process with you because ultimately we need your endorsement for that process. When we're talking about the customer service, public facing aspect of it is once we have those endorsements, we want to create basically, so the county has updated their website. We've done a refresh of all of our planning pages. We basically want to have sort of a portal where people can see severance information. I've started preparing sort of guides and things for folks to have when they're fulfilling their conditions of consent. Now, we'd like to do something similar for an application submission, which is much easier when you have a single sort of way to submit that application. And staff are really dealing with the back and forth on the consultation sort of internally. And so the goal is really, the biggest goal, we're talking about process here, but the biggest goal here is customer service. We want people to know where they have to go, what they have to submit, who's going to review it, and when they should expect to hear back on it. And by standardizing that process and sort of taking the endorsement out at the beginning, we're hoping we can streamline that process so we can get comments that are fulsome, complete, easy to understand, and sort of timely to applicants.
Councillor Dayu?
I echo my thanks. Great presentation. I also echo Councillor Danielson's concerns, Councillor Casey's concerns about the potential removal of council input at some point in the process, just because, as was stated, a councillor of a ward may have a really deep understanding of local dynamics in a way that we cannot expect a county planner or even a town planner to have. It's our knowledge, it's the local knowledge that we bring to the process. So I do wonder if instead of making a touch point with municipal councils optional, if that should in fact be a mandatory part of the process, one that does not include increased staff time at the local level. It doesn't mean any change for the public, but there's just that one moment where even the county planner rep comes as a delegation to council to say, this is what's before us. What do you think? I would hate for, in such a complicated map of steps, for that potential step to actually get lost and fall through the cracks, especially as we have staff turnover and county and township turnover. And who knows, at some stage, it might be lost or forgotten that is an option. And I don't think it should be. I really think that touch point with ward reps on consent issues in that ward should be mandatory. And I do propose that to council as a potential amendment to what is being proposed.
So through the warden to Councillor Dayu, I struggle with that a little bit. Not that I struggle with the idea of council input. Not at all. We currently, that's the process we have. We have no concerns about council being involved. I have a concern potentially around county council sort of dictating to the local councils what they choose to delegate to staff and what they choose to take on and put on their own plates. And I would think that the councils of those local municipalities would be best equipped to make those decisions in terms of whether or not they want to do that or not. And this is just my feeling. But again, this is a decision of county council. We're not pushing this one way or the other. We're just providing an option. And we wanted to make sure you were aware of those options when we made this request, because when we come to your local councils, we'll be asking what they would like to do with that. And we do know that in Minden Hills, they have chosen to delegate at this time in a hope of streamlining and speeding up approvals. I don't feel one way or the other about that, to be completely honest. We will take the direction that council provides us, but I certainly wouldn't want to feel that we're imposing a process on local councils that we don't impose for anything else.
Liz?
Yes, through you, Warden. Just to supplement what Kim just said, our Our entire purpose for laying that out as an option is simply that. It is an option for the local councils to consider, but it's not at all something that has to be considered. We have built into the timelines under a revised process to accommodate full council endorsement processes for all consent applications. If it's something that the local councils want to consider, either partial, full delegation, municipalities that have done that always embed triggers that allow applications to be brought to council or even as a consent authority approval. Sometimes those are even delegated down to staff, but there's always a trigger that, given certain circumstances, at the request of a councillor, if there's issues with an application or a disagreement with an application, those can always be brought to a council and the delegation gets removed for those instances. So it really is an option being presented, but it's nothing that is a commitment at this point. If the local councils feel that it's best to continue as it currently exists with council giving endorsements for every consent application, that can absolutely continue. There's just some food for thought. But ultimately, all four councils can make a decision of what sort of delegation, if any, they would like. It can change council term to council term. It could be, delegated and it's really a choose your own adventure for what you think is appropriate for your local council. So there's no, through this report and the recommendation that staff are bringing forward, there's no commitment to one way or another. It would be completely at the want of the local councils how this all works out. It would just be, at the very least, the endorsement that's occurring now before the county receives an application would be embedded into the middle of the process instead of before the process starts with us.
Councillor Shell.
Just a comment, and thank you once again for all of this, but Minion Hills went in that direction because one of the biggest frustrations next to roads, of course, is we hear from the community that this is difficult for the average person to navigate and to go through. We're constantly wanting to promote people building and doing better things within the county. And we saw this as a means of making it happen quicker. I don't feel like, as a council member, I don't feel like I'm losing any kind of say that I may have or want to have in something. And I support what you've put before us today. And I think that we need to make this as easy for the public as possible. Because like I said, next to roads, that is one of the biggest frustrations I hear from the community, is that the planning process and within the building department as well is very difficult to navigate.
Councillor Rao.
I have a tendency to agree with what Councillor Shell just basically said. We're talking about two different things here. I think the single starting point, one place, it starts at the county, period. What we're talking about is some of the blocks that are in this flow chart can be adjusted slightly depending on what it is that we need to do. My personal opinion is it sounds like you're prepared to consider them, but today's not the day to do that. It's going to take a little bit of time to work it through, go to the other councils, make sure at the end of the day that we've covered all the bases off. But I totally agree. I think the essence of what we need to do is on this particular flow chart that we're looking at. We just have to work out the bugs until we get it to the way it works for all of us. So I support this as well.
Okay. Other questions? Councillor Casey.
Yeah, more of a, I guess if the county's going to take more planning load, I suppose, from maybe more phone calls. I thought I read in the report that we may have to hire a junior planner or more staff at that. And I might be wrong. I thought I read it. Anyway, does that indicate that there'll be less burden on the municipal planners that we reduce staff, or what's the thought process there?
Sorry, did you want to answer that, Liz?
I'll answer that.
I can go ahead. Or did you want to?
I'll answer it. Yeah.
Go ahead.
Through you, Warden. I would love more staff, but there's no proposal for more staff for our department. We can absolutely accommodate this process within our current staff complement of us and our our dear administrative assistant, Kathy. The feedback that we had received from some of the local municipal planners is that they would really appreciate having time freed up to work on projects or give more time to applications that their municipality is actually the approval authority for. They do a lot of work for this process as a commenting agency, and having that equitable shift to putting the process that should rest with us back to us, I think gives more time for the local staff to work on things for the local municipalities. I don't foresee that that would result in a reduction in staff at the local municipalities. I mean, we don't have that many consent applications, but it is a time suck for the local planners. So it just gives them back more time to work on things for their municipalities.
Other questions? Councillor McKechnie.
Yeah, I just think that it's so important that we are addressing this right now, because needless to say, like Councillor Shell and Councillor Danielson said, that it's a big topic at everybody's council. We always hear about how confusing it is for these applications. So it's so great that we are discussing this right now, and we're gonna have to fine tune it, I'm sure. But at least we are addressing the issue, which is the most important thing.
Any other questions or comments? The resolution.
The staff report PLN 11/2026 be receives information, and further the county council endorses the outline approach to consent pre-consultation, and further the county planning staff be directed to seek endorsement from local municipal councils on the proposal.
Someone move. Councillor Shell, second by Councillor Carter. All in favor? It's carried. Thank you. Council, I think we'll entertain a 10-minute break. Okay, we'll call the meeting back to order. For approval of Minden Hills official plan amendment.
Just getting a presentation pulled up. Thank you. To the warden and members of council, the county is the approval authority for local official plan amendments as required by section 17(2) of the Planning Act. It is our responsibility to review amendments for consistency with the provincial planning statement 2024 and conformity with the county's official plan. So the Township of Minden Hills has adopted an official plan amendment, OPA number 18, to their official plan. This is an amendment to create source water protection policies pursuant to the Clean Water Act. So just for a bit of high-level background, the Clean Water Act 2006 was passed in response to the Walkerton water crisis, where a municipal drinking water well was fouled, and thousands of people, and I believe 7 people were sickened and 7 people died. So the province implemented a multi-pronged approach to protecting municipal drinking water sources. So one aspect of that is the Clean Water Act, which is designed to protect municipal drinking water sources, whether they are surface water or groundwater, on a watershed basis. For that reason, source water protection is in the purview of conservation authorities in Ontario because they address concerns on a watershed basis. So in Haliburton County, our municipal drinking water systems, being the ones in Minden Hills and the municipality of Highlands East, are underneath the Trent Source Protection Plan, which was approved in 2015 by the Ministry of Environment, with an amendment made to it and approved by MECP in March of 2026. The county official plan has included source water protection policies since 2017. This amendment is designed to bring the Minden Hills official plan into compliance with the Clean Water Act and the source protection plan policies of the Trent Source Protection Plan. Next slide, please. The amendment is fairly straightforward. So what this does is it creates a new policy in section 4.5, being source protection policies. These are policies that local official plans are required to have. They're outlined within the source protection plan as approved by the ministry. This also creates a designation overlay in the village and rural areas to create wellhead protection areas, or WHPAs. Those are shown on the schedules to the plan that are up on the screen here. On the left, we have the WPA for, or WHPA, pardon me, for the downtown area in Minden Hills. And then on the lower right, we have the WHPA for Lutterworth Pines. It also creates intake protection zones, or IPZs. These are to protect surface water sources. So the WPZ in the upper right on the screen is the mapped area for the Kinmount drinking water source, which is they take their drinking water from the Burnt River. And so they take it from an intake pipe. It's a WPZ. Where you have a drinking water well that supplies municipal water, we have a WHPA. So these areas have zones basically based upon the speed with which a contaminant or a significant drinking water threat, is what they call it in the Clean Water Act, would have the ability to infiltrate the ground and make its way either to that pipe or that well. They held a public meeting on March 12th, 2026. They received no comments from the public. However, comments were received from agencies. So the County of Haliburton provided some comments. The City of Kawartha Lakes, who are responsible for maintaining the Kinmount drinking water source, provided comments. And Lower Trent Conservation, on behalf of the Trent Conservation Coalition, provided comments. The Trent Conservation Coalition is a collective of conservation authorities in the Trent watershed that kind of collectively manage that source protection plan. The Township of Minden Hills issued a notice of decision on May 13th, 2026, and the county received the prescribed materials in the application from the township on June 24th, 2026. So as mentioned previously, as the approval authority, we did have to review these policies for conformity with the county's plan and consistency with the PPS. Next slide, please. So the PPS provides a lot of direction with regard to safe drinking water. So section 3.6 requires that municipalities plan for their water, sewage, and stormwater services in a manner that can be sustained by the water resources that they rely, and that they must also protect human health and safety as well as the natural environment. When planning, Section 4.2.1 of the PPS specifically requires municipalities to implement necessary restrictions on development and site alteration as required to protect all municipal drinking water sources and designated vulnerable areas. Those vulnerable areas are the IPZs or the WHPAs you see on the schedule. Section 4.22 directs that development and site alteration be restricted as necessary in these areas to protect, improve, or restore sensitive surface and groundwater sources. This also allows municipalities to have mitigative measures or alternative development approaches if they're required to achieve this outcome. Next slide, please. With regard to the county's plan, as noted, we've had source protection policies since 2017. When we received this application from the Township of Minden Hills, we did review our policies to ensure they were still in compliance with the updated source protection plan that received amendments right in the beginning of March of this year. County plan is still in conformity with that plan, so no amendment to the county plan was required. Just a couple of notes. So the county plan requires that local official plans have source protection policies for municipal drinking water systems. Where a source protection plan identifies a county or local municipality as the implementer of policies to protect municipal drinking water sources, those policies must be implemented into plans or bylaws. And it requires local official plans to identify the WHPAs or IPZs on their maps or schedules. And so this amendment brings the source protection policies of the Minden Hills official plan into conformity with the county plan. Next slide, please, Travis. So our recommendation today is to approve this without modification. It has been reviewed by the Conservation Authority responsible for the plan, by the municipality's risk management official, and has been sort of vetted through all the appropriate channels. It brings the municipality into compliance with the Clean Water Act, which is really, really important. And we consider it to be in conformity with the county's official plan and consistent with the Provincial Planning Statement 2024. So as mentioned, we're recommending approval. And I'm happy to answer any questions should council have any.
Thanks, Kim. Questions, comments, resolution?
Staff report PLN 10/2026 be received for information, and further Haliburton County Council approves in its entirety without modification official plan number 18 to the Township of Minden Hills official plan that was adopted by Township Council for Minden Hills on April 30th, 2026 through bylaw number 2631.
If someone move, Councillor Shell, second by Councillor Casey. All in favor? It's carried. Thank you. Okay, Planning Department work plan update.
Thank you, Warden. I will talk a little bit louder and hopefully a bit slower for folks at home and in the horseshoe. A couple of our recent efforts are on the agenda today, being the consent process refresh and the first of a couple of proposed official plan amendments. Other items to note is our senior planner, Kim, is lending her abilities to the Township of Algonquin Highlands 2 days a week in the interim while the township recruits for their planner position. We're also working on either updating or creating application templates for our various approval processes. Many are either out of date, they don't meet accessibility standards, or simply don't exist for some processes. So that is something we are trying to get done as soon as possible to just help with the standardization and process efficiencies moving forward. We're also working on a vendor of record program to help streamline the peer review process. When it comes to development approvals, sometimes peer reviews can extend development application processing timelines significantly. So by creating a vendor of record repository, it allows us to shorten up that procurement process to get peer reviews done. As sort of related, in the 2027 year, we're hoping to create a full suite of terms of references for all the technical studies so that any applicant will be able to take that terms of reference, give it to a technical consultant. They'll be able to base their technical report on that, which will be based in provincial legislation or whatever is applicable to that subject matter. And that will reduce the amount of time, as if they have provided everything that's in that terms of reference, the review of that technical report should be quite quick. So that's on tap for 2027. With respect to Land Division Committee activity, our numbers are down from previous years for this time of year, which I think just by nature, development ebbs and flows, and right now, people must be developing on lots that already exist. Like previous years, though, the majority of applications are for lands in the rural area. Shoreline bylaw activity has seen an uptick, which was anticipated given the time of year. The existing Part 3 hearings are still ongoing, and we have had a few complaints recently that are looking to convert to enforcement efforts to rectify non-compliant shoreline work. So there might be a little bit more activity for us at the POA moving forward. We also have, we have also had quite a few calls about invasive species such as hogweed across the county. Our contracted county forester, James Rogers, is able to mitigate issues such as this. So we do appreciate when people make us aware of sightings, and we do encourage the public to let us know if they do come across concerning plant species such as hogweed, because we can send James out to remove them for the safety of the public. So with that, I'd be happy to answer any questions council may have.
Questions?
That staff report, PLN 13-2026 Planning Department Work Plan Update be received as information.
Someone move. Councillor Carter, second by Councillor Ryle. All in favor? It's carried. Thank you. Proposed County Haliburton Official Plan Amendment 2.
Thank you, Warden. Okay. For consideration today is a housekeeping amendment to the county's official plan, being Official Plan Amendment 2. Next slide, please. The county's official plan has been in force since 2017. And since that time, staff had worked with the plan, and in doing so have identified opportunities to improve clarity, usability, and effectiveness of it. This is not out of the norm for official plans. Municipalities often update their plans from time to time as items are identified for improvement. Being that the plan is 9 years old and a lot has changed in the world of planning since then, there are other components of the plan that are due for updating. However, they're not housekeeping in nature and are more appropriately addressed separately, which is our plan for the near future. So with that, the purpose of this presentation today is to introduce the proposed housekeeping amendment to council and seek direction on next steps. Next slide, please. The content of the amendment can generally be divided into 5 categories. With respect to resource-based recreational uses, it is proposed that a definition for what a resource-based recreational use is in order to provide clarity and align with provincial policy. For aggregate resource policies, the plan currently scatters applicable policies across different sections. It is proposed that the policies are consolidated into a single section and are updated to provide better policy differentiation between aggregate deposits and active operations, and clarity on what provincial guidelines permit with respect to development in proximity to those different types of uses. For rural area access and lot frontage policies, the official plan currently contains strict frontage requirements for new lots on county roads, being either 150 or 135 meters for rural lands, depending on road characteristics. While this approach is used by other municipalities, it's not the only approach that can be taken. Other municipalities utilize a more flexible approach wherein there is a minimum frontage benchmark established in zoning. However, the extent of frontage needed for a lot is based on engineering sightlines for driveway feasibility. Given a significant amount of lot creation occurs in the rural area, and at times the only impeding factor for a proposal is this strict frontage requirement, staff thought it would be appropriate to amend the policies to adopt the more flexible approach. In terms of consent policy updates, and in keeping with the theme of flexibility, staff are proposing to introduce policies to allow for severances of lots that inadvertently merged on title. Oftentimes, these lots are deficient on size and frontage, but are still suitable for development. Criteria would need to be met in order to pursue this process. However, right now, there are no policies for this type of severance. It's also proposed that a clarifying policy be added to specify the conditions which determine the number of lots permitted to be severed through consent, i.e. the existing lot's creation date. This already exists in the local plans, so it's just a matter of bringing it up to our plan for consistency. Lastly, many revisions are proposed related to clarity, consistency, and ease of interpretation, consolidating topics into single sections, updating provincial references, fixing misidentified schedule references, and simplifying wording for better readability are proposed. Next slide. So it is our recommendation that Council directs staff to circulate the proposed amendment in accordance with the Planning Act requirements and schedule and advertise for the statutory public meeting. If Council has identified any proposed changes that are of concern, or if Council would like to include any changes that might have been missed, we're happy to look into those further and update accordingly prior to circulation. So with that, be happy to answer any questions Council has. Thanks.
Thanks, Elizabeth. Questions, comments, resolution?
That the draft County of Haliburton official plan number 2 housekeeping amendment be circulated to the local municipalities, indigenous communities, agencies, and other stakeholders for comment, and for that the statutory public meeting be scheduled for the proposed amendment.
Someone move. Councillor Dayu, second by Deputy Warden Danielson. All in favor? It's carried. Thank you. Economic development, physician recruitment. Wendy, please.
Good morning, Warden and members of County Council. I bring before you today a report regarding the renewal of a 12-month lease for a property used for physician recruitment. The 1007 Deer Point Lane has been leased for physician recruitment purposes since 2022. Since then, the rent has stayed at $2,200 a month. And last year, it was approved to have an additional $2,000 at the end of the lease to support usage during the peak summer season. The property owners are asking for an increase at this time, just $150 a month. And so that would bring it to $2,350 a month. Staff has a very good relationship, a cooperative relationship with these property owners. They're very quick to respond to any issues. And we've also received positive feedback from physicians that stay there. And there continues to be a very high rate of occupancy, which recovers the cost for this back to the county. So I welcome any of your comments or questions about this lease renewal.
Thanks, Wendy. Any comments, questions? Councillor Dayu.
I'm really happy to support this. I think the more we can do to bring in new faces into the county is great, and it's a small expense given the benefit that comes in.
Okay. Comments, resolution.
The staff report EDT 07-2026 lease renewal be approved as submitted.
Can someone move? Deputy Warden Danielson, second by Councillor Ryle. All in favor? It's carried.
Thank you.
Thank you. IT Terranet subscription additions. Aaron, please.
Good morning, Warden Burton and members of council. Before you is Report ITS 08-2026, a report recommending additions to our current TerraNet subscription. Our current subscription includes the Ontario Parcel Assessment Mapping, which is then linked with property ownership data from MPAC. The proposed additions would add ownership mapping and the ownership property report, which includes property identification number or PINs, ownership information at the time of registration, instrument numbers, and other land registry information that staff currently have to access piecemeal through services like OnLand and TerraView. This additional information will allow county and municipal staff to more efficiently look up property information and provide more up-to-date ownership information than what we have currently. For instance, staff will be better able to see property information where an assessment roll number hasn't been assigned, such as right-of-ways, municipal property, roads, and that type of thing. As well, when staff need to do property searches, which can cost anywhere between $75 to $200, depending on how much information needs to be pulled when they do them internally, much of the information will be available through the mapping and ownership report and accessible in a more efficient manner. The modified TerraNet subscription will cost $107,000 over 5 years, $85,000 of which will be new spending. And the additional costs will be split evenly between the county and participating municipalities, working out to approximately $5,000 per party per year. This has been budgeted in the 2026 IT budget, and the purchase has been approved by the CAOs of their respective municipalities. I'm happy to answer any questions you might have.
Staff report ITS 08-2026 TerraNet subscription additions be received, and further that the county council approve the contract with TerraNet Enterprises Inc. for a 5-year term at a total value of $107,000.
Someone moved. Councillor Carter, second by Councillor McKechnie. All in favor? It's carried. Thank you. Thanks, Aaron. Bylaws?
That bylaw 4353 being a bylaw to authorize an amendment to the county's agreement with TerraNet Enterprise Inc. to include an Ontario parcel ownership mapping and ownership report on a quarterly basis.
Have someone move? Councillor Ryle, second by Councillor Carter. All in favor? It's carried. Thank you.
Sorry. Yeah.
Number 2.
Yeah. The bylaw 4355 being a bylaw authorizes the submission of an application to Ontario Infrastructure and Lands Corporation for financing of certain capital works of the corporation of the county of Haliburton to authorize temporary borrowing from OILC to meet expenditures in connection with such capital works and to authorize long-term borrowing for such capital works through the issuance of debentures to OILC be considered to be read a first, second, and third time.
Someone move. Deputy Warden Danielson, second by Councillor Shell. All in favor? It's carried. Thank you. Motion bylaw.
That bylaw 4354 being a bylaw to confirm the proceedings of county council be considered to be read a first, second, and third time.
Someone move. Councillor Ryle, second by Councillor Carter. All in favor? Carried. Adjournment.
That the July 22nd, 2026 meeting of Haliburton County Council be adjourned at 11:06 a.m.
Someone move. Councillor McKechnie, second by Councillor Shell. All in favor? Carried. Thank you. Thank you, council.